And I said, come over, just come on over, you'll say. Yeah, I said, come over, come on over, you'll say.
Good afternoon, ladies and gentlemen, and welcome to the Town of Portland podcast, live here at the Town Tech Educational Partnership podcast studio at Portland High School. And this is going to be episode 11. And I'm your host, Dave Kosminski. And with us today is our cast of characters. In fact, we have a newbie with us today, but our frequent flyer, Mr. Russ Melmed, who is our Chatham Health Director from the Chatham Health District. He's going to be joining us on the phone. And a new personality joining us in the studio this time is Miss Nancy DiGirolamo, who is the Collector of Revenues, for the Town of Portland, both on the tax side, and she also handles the water and sewer with her able assistant, Tracy. Anyway, Susan is going to be joining us very, very shortly. In fact, one of our building maintenance custodians is retiring, and she's reading a proclamation, but she will be joining us here in the studio momentarily. So without any further ado, we're going to put it over to Mr. Russ Melmed, again from our Chatham Health District. And hope you're doing well, Russ. And again, thank you again for taking time out of your schedule to join us on the podcast.
Sure, Dave. Thanks for having me on again. It's always I'm starting to look forward to coming on and having these conversations with the listeners and with you guys. It's really been enjoyable. It's been an enjoyable experience. So I carve it out because it's important, and I also carve it out because I like it. So thanks for letting this happen and making this happen.
No worries. Frequently. No worries. So what's happening?
So today, I've been talking a lot about COVID-19, and I'm sure everybody is a lot of information out there. Today, I want to have some brief remarks, and I really don't want to talk much about COVID-19. And the reason I want to talk about COVID-19 is because right now, at least, it feels a little bit tone deaf. And that's because of what's going on with protests, Black Lives Matter protests around the country because of the murder of Mr. Floyd in Minneapolis. And I don't want to speak about police use of force specifically. I want to talk about racism writ large as a public health issue. And if I could just give you as a public health professional, my Mount Rushmore, if you will, of public health issues. And these are big things, and I'll put them in order, and they go like this: climate change, racism, antimicrobial resistance, and COVID-19 now has to be on there, of course. Antimicrobial resistance, I might put fourth, actually put COVID-19 third, but climate change, racism, they're at the top of Mount Rushmore public health issues. And a lot of people might not think of racism as a public health issue, but we see it in every measure of the health of our population, just about every measure. And I'll throw out just a few statistics for people in Middlesex County, for example. One of the primary things that we look to as a measure of the health of a population is birth weight. And the birth weight, when we see birth weight among whites and birth weight among blacks, low birth weight is 2 times higher among blacks than whites. Infant mortality is the same. Cancer and cardiovascular disease, the same. Overall mortality, years of potential life lost, which is a jargony term that we use in public health. I mean, if everybody is expected to live to 75 and you die before that, you die at 74, that's 1 year of potential life loss. It's a very simple measure. Blacks experience 56% more years of potential life loss on average in Middlesex County compared to whites. Think about that for a moment. The Connecticut Hospital Association, they publish data frequently about preventable hospital stays, things like ambulatory care sensitive hospitalizations, things that could have been taken care of early if you had access to a doctor, but puts you in the hospital. Blacks experience preventable hospital stays at a rate 60% higher than whites in Middlesex County. Even some of the things where you see measures that show that our residents of color have more favorable measures, like opioid overdoses, for example.
Right.
We see actually white populations experience opioid overdose at higher rates than our black residents, and we wonder why is that? And that actually has a racist a foundation as well, a foundation in racism. And
Sure.
I'm not talking about overtly racist acts. I'm just talking about implicit bias. And what happens with opioids is, that's basically because blacks have reduced access to health care.
Mm-hmm.
They're less likely to be in front of a physician for anything because they have less access to health care. And often opioid misuse starts with the prescription of an opioid pain reliever. So if you have blacks who are seeing physicians less often, then they're less likely to get prescribed an opioid and less likely to have that lead to overdose. And the other contributing factor here is that prescribing practices, even if you have access, whites versus blacks, whites are more often prescribed opioid pain relievers than blacks for the same conditions. And you wonder why, and that's because of racism. Not overt racism, but physicians will often prescribe differently and prescribe treatments differently just based on the color of somebody's skin.
Sure.
And it's not, again, deliberate. It is just on a population level. This is what we see.
Exactly.
So we see this in all these measures, and it really these measures have a foundation in the history of racism in the country. I'm not asking anybody to raise their hand and say, it's my fault. But when we look at the systems that were in place in this country for hundreds of years, structural and institutional racism, from slavery to Jim Crow laws, segregation, to our policies around incarceration for drug crimes. We see it all along down the line.
Right.
What this all has led to over the years is less opportunity for people of color compared to people who are white. The accumulation of wealth and opportunity in white populations.
Mm-hmm.
And when you have opportunity, you tend to be healthier. You have more opportunity to get education, you get a good job. You can see it in all our economic statistics in Middlesex County, for example. Black families have a $47,000 median household income compared to white families with an $84,000 median household income.
Right, right.
So, I hear the cries of people who are protesting right now because of what happened in Minneapolis, and I see this as just a one symptom, police use of force, one symptom of broader issues that can be looked at as public health.
Exactly. Exactly. The other thing too, Russ, now there is also an emotional component, not only on blacks and people of color, but also on whites, because I know it was brought up in the Board of Education meeting the other night. Kids in the younger grades are struggling with how to process all of this. So there is definitely an emotional component that goes along with this, and that again that is colorblind from the standpoint.
Yeah, certainly stress. I mean, the stress of the current moment, of the current situation, and stress does lead to increased risk for various chronic health conditions.
Sure.
And so whether you're white or black and you're experiencing stress, it's gonna put you in a higher risk category, but our populations, our residents of color, they experience stress every day as a result of the racism they experience.
Sure.
And that's a very different experience to our white residents. I mean, certainly stress is something universally experienced by everybody in different circumstances, but our residents of color do experience that on a much more regular basis, whether we see it or not. And it's, so stress of the moment, again, stress writ large in your life, growing up as a child, experiencing racism, bigotry, prejudice, and all its forms does result in some bad outcomes for our populations of color. So
sure, not to mention the COVID-19 aspect effect on all of this.
COVID-19. You're talking about protests. I do worry about that. I do worry about people gathering together. So I would just like to put this out there: if you're going to go out and you're going to demonstrate, please do so safely. Wear a mask for the protection of others around you, and try to stay as much as you can 6 feet away from everybody. Those recommendations are there for a reason. The virus really is colorblind in crowds. White, black, doesn't matter. If you're in a crowd and somebody's sick, you're you can get exposed. So
and it's marching with you, or whatever.
It's marching with you. It's marching next to you. So please be careful and please be safe when you're out there. Wear a mask. Stay 6 feet away.
Sure.
I would put gathering together in crowds as a risk factor for COVID-19. So pay attention if you've been out there demonstrating. If in the next couple of days, the next couple of weeks, you start to get symptoms, consider COVID-19 and consider getting a test.
Sure.
And follow the recommendations.
And speaking of the COVID now, what are the latest stats on that, real quick? As far as in relation, I know things are trending in a downward motion, so I guess that's good. So
we are seeing we are seeing less COVID-19 generally in our community. We are seeing a focus of testing in our long-term care facilities and other congregate settings like prisons and things like that. So we are seeing a few more cases every day than we were just a couple of weeks ago. But when I break that down and I look at the percentage of those tests in long-term care facilities versus community-acquired COVID-19 infection, we're somewhere in the area between 50 and 60% of our new tests in the last couple of weeks have been in long-term care facilities. And, earlier on in the outbreak, it was somewhere between 30, 40, 50%. So we are seeing, of our cases, a higher percentage of them coming back from long-term care facilities. So I'm not saying that's a good thing. That is not what we want to see, but the state is going out and doing considerable amount of testing in long-term care facilities. They're doing point prevalence surveys where they test everybody in a nursing home all at once in the same day, and they're finding a lot of asymptomatic cases. So we are seeing an uptick in the cases, across Chatham Health District overall, but that is not due in large part to community transmission. It is because of the focused efforts in our most vulnerable populations in those long-term care facilities.
Sure.
So we're still looking pretty good. We're seeing more testing and fewer cases in the community. We're definitely below the 10% threshold of positive test results. So of all the tests that are done, we want to see that number below 10%, and we are well below that in Chatham Health District, somewhere in the area of 6%. So we're doing very, very well, and I hope to continue to see that do well. It doesn't mean COVID's gone. Doesn't mean people should be casual about their exposures, continue to follow all the recommendations. But I think we're seeing the first wave come down, and so long as everybody keeps doing what they need to do, I hope to continue to see it move in that direction.
Sure. And have the fatality rate stayed steady?
And we're seeing a few. We are seeing a few more fatalities, but the rate has remained steady. And principally, our fatalities are unfortunately among our oldest adults and people who are living in long-term care facilities. Those make up the vast majority of our fatalities. I think in Chatham Health District, we're somewhere in the area of 31 fatalities. I think Portland is between 12 and 14. So the people who are experiencing the worst outcomes are people who have underlying health conditions mostly, and people who are older adults. So if you are older, if you have an underlying health condition, especially an immune condition, please stay safe, stay home. Don't take any risks that are unnecessary going into any groups, large gatherings, things like that. Really stay home as much as possible. You are still at increased risk.
Great. Well, thanks, Russ. I appreciate that. I know, and I don't know if you want to mention, but I know the governor in a new executive order has relaxed some of the restrictions on the upcoming graduations. I don't know if you want to touch base on that, or we can at least let people know that things are changing.
Yeah, I'll just mention it quickly. The governor has indicated that on or after July 6th, graduation ceremonies in person, up to 150 people, so long as everybody wears masks and stays 6 feet apart, are going to be allowed. I feel bad for our school districts because they've really gone through a lot of trouble and effort to plan for different kinds of graduation ceremonies. Typically, they've been the drive-up or the drive-through. And I don't know how many are now going to wait, throw away those plans and plan for something in person up to 150. But that's what's out there now. So, in-person graduations can happen on July 6th, up to 150 people. So I wouldn't be surprised if we do see some of our schools switch gears a little bit. But it is a big challenge for them because they've been doing a lot of planning around these different, modalities of graduations. And schools have a lot of other planning to do around summer schools
exactly.
and perhaps reopening in the fall, and how are they going to accommodate camps in their buildings and things like that. And to go back and trash plans that took a lot of time and effort to work out and do something else,
go down another road,
really is difficult.
It's tough. All right. Well, thank you, Russ. I appreciate that. And again, as always, thank you for your time and all of your diligent work to not only you, but the staff of the Health District. And we'll see you hopefully next week and go from there.
Yep.
All righty.
Thanks, Dave.
Did somebody else come on the phone with us?
Yeah, it's Susan Bransfield. Hi, Dave.
Hey, Susan, how are you? Okay, Russ just got through with his update, so very, very timely as far as you're here. We have Nancy DiGirolamo also in the studio with us. So, Susan, why don't you take it on your end, and we'll go from there.
Okay, I have a short update for folks, Dave. Thank you. Last night, Wednesday night, the Board of Selectmen met, and they talked about many things. And one of the things that we talked about is, as we've all unfortunately learned, of the terrible situation in Minneapolis, where Mr. Floyd was killed, with such a truly horrific situation that it touches everyone throughout our country. And certainly I've been hearing from many, many, many of our residents in Portland, and their interest in making a statement that we don't tolerate, we don't at all want to have racism, bigotry, prejudice, any of that in our town or in our country. And some of the things that the selectmen discussed last night was issuing a statement. And they put together, I thought, a very well-written proclamation stating how important it is that we stand in solidarity and really have respect for all races, all people in our community, and that we just not state it, but that we do things. And I would say in the next several weeks, months, and years, we're going to be working very hard toward that solidarity in our town through lots of different activities, training for our employees, including our police and emergency personnel. We're going to expand into our schools, teaching staff, and really as a community making that statement that it's not just 1 or 2 days that we want to make information available, but it becomes part of our community. It's sustainable and something that we truly, truly believe. So we look forward to working with our entire community in being able to address this. So
Absolutely.
More to come, Dave.
I know, and ironically, you jumped in late, but Russ's focus on his was basically racism on the effect on public health, and that ties in so very, very well as far as that goes. And Russ, I don't know if you want to comment there.
No, I don't want to take up too much more time. I think the issue of racism impacts the health and well-being of all our residents.
Sure.
It is not just our residents of color.
Exactly.
It really does impact the community. If we lift up those who are struggling the most, we lift up an entire community.
Sure. And I think that was quite evident on the conversations last night at the Selectmen's meeting that Susan so eloquently addressed, not only with the board, but had some very, very good and positive public comment on how to proceed forward. And I think as a town, I think, Susan, you got the ball going in the right direction here. Sure. Anyway, with us, Susan, is there anything else?
I think I'm all set, Dave. I'm looking forward to listening to Nancy.
Okay. Well, why don't you set Nancy up here on basically how we got to, what the Board of Selectmen approved in relation to the COVID relief on the taxes, and then we'll turn it over to Nancy.
Sure, be happy to. Several weeks ago, the governor made available some help to our residents in terms of taxes, local property taxes. And the selectmen decided to offer to the community the ability to, if they can't make their payments on time, that the interest that would be charged for up to 90 days after the date the taxes are due, it would not be at the usual 18% annual interest, but rather it would be reduced substantially to 3% per year, interest. And that should be of great help to our residents who are unable to pay on time. And it's something that, as I said, is offered for up to 90 days past the due date. In working with Nancy DiGirolamo, who is our head of the collection of revenue in our town, she and I have been working together to make sure that information got out to our residents. It will be going out, and I'm sure Nancy will give us some more information on the mailing that will be done and has been done. And we're also going to be working with our Public Works Department is helping us in terms of putting up a better box in the back of Town Hall. And it would be available for our residents to safely put their taxes into the box so that it's safe. And I think Nancy's going to go into a little bit more about that. Mm-hmm. With the COVID-19, we have to be very careful about minimizing the exposure of this virus. And one of the things is to minimize contact if it's not necessary. And so Nancy and I have been working on that for our residents and during this July and into August and so forth for their paying of taxes. So I look forward to hearing you, Nancy. I know that you have a lot to share with our listeners.
Sure. Okay, great, Susan. Thank you. And again, we're going to turn it over to our first-time flyer here at the podcast studio at the high school. Okay, Miss Nancy DiGirolamo, and she's been in the business quite a long time and has established a pretty long tenure here in the town of Portland. So, Nancy, welcome to the studio, and it's all you.
All right. Well, thank you for having me. First of all, I'd like to explain that this July, in with your bill will be an insert explaining the COVID-19 low interest rate program, which will be applied to any interest which is charged after the last day to pay, which would be August 3rd. If not paid by August 3rd, interest will be charged at 0.25% for the month of July, August, and September. After that date, as of October 1st, the interest will be revert back to the original 1.5% per month, including the month of July. That is under the COVID-19, like I said, the COVID-19 low interest rate program, which was part of the executive order that the town of Portland did adopt. Mm-hmm. Tax collection will look a little different this July based upon the COVID-19. The town hall will be closed to the public. However, we're always there for you, be it by email or telephone. Telephone number is 860-342-6737. My email is ndigirolamo, that's ndigirolamo @portlandct.org if you have any questions. As far as tax collection goes, because of the fact that we're not open to the public, we do have other ways of payment. Like Susan mentioned, we do have a secure drop box, which will be actually two, one attached to the building that has been there all along, and also a large box, which is very secure for payments to be dropped in. Payments may also be mailed to the Town of Portland Collector of Revenue at P.O. Box 71, Portland, Connecticut, 06480. And also, we also have the option of paying online through the Town of Portland website at www.portlandct.org. And from the homepage, you would click on Departments and Collector of Revenue, and at that point, there are links to look up your bill or pay online. There are convenience fees involved, of course, but that is another option for you. And I think that is about it, unless you can think of anything else, Susan, that I have left out.
I think you've covered it very nicely, Nancy, and given a lot of good information for our listeners. Thank you.
Sure. And again, as the town hall is closed to the public, in fact, they just finished installing the foundation for the new box this week, so that that new box should be coming, probably the early part of the week next week, and that should be ready for people to drop off their payments and so forth.
I just have one more thing to add. This is Nancy. Unfortunately, cash is not accepted in the boxes. If you prefer to pay by cash, we just ask that you either purchase a money order or use another option such as a bank check or, like I said, online. But unfortunately, we can't accept cash left in the drop box.
That's smart, as far as that go. Yes, and I think from the standpoint of the governor's executive order and giving the towns option, and obviously you worked with Susan and the Board of Selectmen on, felt that this was the better option, for the town and for the town's residents to make themselves avail of the lower interest rate. So rather than getting whacked 18%, as far as that goes, sure.
Right. Mm-hmm.
So anyway, great, Nancy. Thank you. I think that about is it. I think Susan, if you don't have anything else, I think Bob is hung up right now, but I think things have been going fairly smoothly on the bridge. I think they're making very, very good progress in relation to a lot of the construction and the.
I would agree. They're making progress, Dave. I would say that on occasion, there are interruptions, and we all should expect delays. In fact, this morning, I had to go to Middletown, and I did have a delay. It was short-lived, but I know that over the course of several previous days, there has been some prolonged delays.
Sure.
And one of them was an accident. There was a minor rear-ender that happened on the bridge, and in order to attend to the situation, the police on the Middletown side and the Portland side do close the bridge and attend to the accident. So I would advise everybody to be aware there can be delays and to please be patient and try to plan ahead as much as you can so that you leave some time in crossing the bridge. I will say that our fire chief, Bob Shea, has taken care to make certain that our residents are well cared for, both for emergency medical as well as fire calls. And there are, most of the time, the ability to have an ambulance staged and available. We knew there was an interruption that was occurring at one point this past week, and Bob was able to make certain that we had emergency response on the ready and able to take care of our residents and transport them either to the emergency room in Marlborough or to some other health facility. So we do take great care, but we also know that is our lifeline to get to Middlesex Hospital and to other places in Middletown that are so important to get to. So please drive slowly.
Yes.
Drive below the speed limit if you can. The lanes are narrow, and there are distractions, and there could be, as I said a few minutes ago, accidents on the bridge. In other news, I know that Bob Shea reported, I think last time, that there is going to be some work done, long needed, on Maple Road in the vicinity of Job's Pond Road. So there'll be some improvements to that road. And we'll also be starting road work in July, our usual improvements that Public Works makes. And this past week, the Selectmen passed a resolution to allow improvements to occur at the salt shed, which is in the vicinity of Sage Hollow Road. And that's been a long time in coming. Bob and his team have done a tremendous job in getting a successful bid, and we look forward to having that repair done. There's some improvements that are being made to that shed. It is in a sensitive area, so from the environmental perspective, we're protecting an aquifer, we're protecting the environment in general in that area with these improvements. And also, I'm proud to say that most of it is being paid for with a state of Connecticut Small Town Economic Assistance Program grant of over $200,000. So we're quite proud of being able to have a grant help us with this, and thankful to our citizens for making sure that that gets funded, and it's going to happen soon.
Grants are always good. Absolutely. Yeah, for sure, for sure. All right, I think that about wraps us up here for episode 11 at our Town Tech Educational Podcast studio here at Portland High School. And again, our guest today, obviously, is our Chatham Health Director, Mr. Russ Melmed, our First Selectwoman, Ms. Susan Bransfield, and for the first time on the podcast, our Collector of Revenues, Miss Nancy DiGirolamo. So thank you so much, all. We're going to be doing this every Thursday, starting at noontime. And again, this broadcast will be post-processed and got on and put onto the Channel 15 educational channel on the Comcast television network. And you can view that, view the podcast on that. And that is usually run on Tuesdays from 9 in the morning and at 4 in the afternoon. So, and they also run it on Saturdays. So, depending on the time. So, thank you so much, all, and we should be all set. And in the meantime, next week we'll have next Thursday. Actually, we'll have the graduation here at Portland High School, which is going to be a drive-in graduation. So, and that should be very, very nice. And hoping for good weather. So. Until then, stay home, stay safe, and wash your hands. Thank you so much.